Let me ask you something. What did you do last night before you turned off the light? Did you eat a late dinner? Watch TV until midnight? Skip your medication because you forgot? I'm asking because what you do in those final hours before sleep is doing something to your heart that most people over 60 have absolutely no idea about. Not once a month, not occasionally, every single night. And the most frightening part? The events that kill people in their sleep, the heart attacks, the strokes, they almost never announce themselves. There's no dramatic chest pain, no warning. Just a quiet night that turns into something no one saw coming. I've been in the operating room at 3 in the morning holding a heart that stopped while the patient's family was still asleep at home. And in case after case, when I trace back what happened, it wasn't bad luck. It was a late dinner, a skipped medication, a bedroom that was too warm, a body that quietly ran out of water. Ordinary things, things that happen in millions of homes tonight. Stay with me, because what I'm about to show you could be the most important thing you hear this year. Here's what most people believe about heart attacks. They believe there's a warning, chest pressure, left arm tingling, a dramatic moment. That's what the movies show. That's what we all expect. But after 60, the most dangerous cardiac events are the quiet ones, the ones that build slowly while you sleep, while your guard is completely down, while your body is supposed to be recovering. And here's the thing that stops my patients cold when I tell them this in my office. Those events are almost always triggered by something completely ordinary, something you did before you turned off the light. That's what we're going to talk about today. 5 habits. 5 things that happen in the hours before sleep that are quietly loading the gun while you think you're just winding down. And I'll give you the exact fixes. Simple, specific, things you can start tonight. Now, the one that surprises people most is number 3. Most patients hear it and say, "I've been doing that my whole life." That's exactly the problem. Stay with me. My name is Dr. Ben Bates. I've spent more than 20 years in preventive medicine, working specifically with adults over 60. I'm not going to throw statistics at you and send you home with a pamphlet. I'm going to tell you what I've actually seen, in real patients, in real situations, and what I wish someone had told them before it was too late. Before we get to the habits, I need you to understand one thing, because once you understand this, everything else will make sense. Your heart doesn't rest when you sleep. It shifts gears. In a healthy body, nighttime is a biological reset. Blood pressure drops 10 to 20%. Heart rate slows. The arteries relax. Your body uses those hours to repair itself, to stabilize, to prepare for the next day. But after 60, that system becomes less reliable. The blood vessels stiffen. Pressure regulation gets less precise. The hormonal signals that protected your heart at night start to weaken. Think of it this way. During the day, your cardiovascular system has backup mechanisms. It can compensate. It can adapt. At night, most of those mechanisms are offline. Your body is running on a skeleton crew. And that's what makes the hours between midnight and 6 a.m. the most dangerous hours of the day for people over 60. Not the afternoon, not the morning commute, the quiet hours. The hours when no one is watching, but your habits are. And what happens during those hours is almost entirely determined by what you did before bed. Let's start with the one that affects almost everyone and almost no one talks about. I want you to think about last night's dinner. What time did you eat? And what was on that plate? When I ask patients this in my office, I hear the same answer over and over. 8 o'clock, sometimes 9. A full meal, pasta, rice, something heavy, and then the couch, and then bed an hour later. I understand why. Busy days, family schedules, the habit of a lifetime. But from a cardiac standpoint, that habit is quietly stressing your heart every single night. Here's what's actually happening inside your body. When you eat a large meal, your digestive system demands a sudden increase in blood flow. Your heart pumps harder. Blood pressure rises. The fats in your blood, triglycerides, spike sharply within 2 to 4 hours after eating. Now layer that on top of going to sleep. Your body expects the evening to be a slowdown, a wind down. Instead, your heart is fighting 2 battles at once, digesting a full dinner while trying to shift into its nighttime recovery mode. Those 2 demands are in direct conflict, And in a person over 60 with any arterial stiffness, that conflict has real consequences. Studies have consistently shown that eating within 2 to 3 hours of sleep raises nighttime blood pressure, increases the kind of fat in the blood that promotes clot formation, and is directly associated with higher rates of cardiovascular events during sleep. The fix is not complicated. Finish your main meal by 6 or 7 in the evening. If you eat later, keep it light. A small amount of protein, some vegetables. Not pasta, not fried food, not a second dinner. Does your evening look anything like what I just described? Type yes in the comments if it does. You'd be surprised how many people make this connection for the very first time right now. Now this next one, I need you to take this seriously, because this is where some of the most preventable damage happens, and almost nobody talks about it. If you are over 60 and you take medication for high blood pressure, and statistically, more than 60% of people your age do, the timing of that medication matters enormously. More than most doctors take the time to explain. Here's what you need to understand. Blood pressure follows a curve through the day. It rises in the morning, peaks in the afternoon, and is supposed to dip at night. But a significant number of people over 60, particularly those with hypertension, don't get that nighttime dip. Their pressure stays elevated. Or worse, it surges during the early morning hours. There's a name for this: nocturnal hypertension. Most people have never heard of it, and it is dangerous in ways that daytime high blood pressure simply is not. Here's why. While you sleep, your arterial walls are relaxed. They're not braced for impact. A pressure surge at 3 in the morning hits those walls very differently than the same pressure at 3 in the afternoon. It's more likely to rupture a vulnerable plaque inside a coronary artery, more likely to trigger clot formation, more likely to send someone to the emergency room before sunrise. Now, if you take your blood pressure medication only in the morning, it may wear off completely by the time you need it most. If you sometimes forget it, you may be leaving yourself unprotected during the most vulnerable hours of the night. What should you do? Talk to your doctor specifically about timing. Ask whether your medication should be taken at night instead of, or in addition to, the morning. That conversation takes 2 minutes. There's strong evidence, including findings from large clinical trials, that evening dosing of blood pressure medication significantly reduces cardiovascular risk during sleep. That is not a minor adjustment. That is a potentially life-saving conversation that most patients have never had. Don't assume the timing doesn't matter. In cardiology, timing can be everything. Now I want to talk about something that most households treat as a punchline: the snoring. A spouse who rattles the walls at night. Something to elbow them over. Something to laugh about at breakfast. I want you to hear this from me directly. I do not treat snoring as a punchline. I treat it as a cardiac warning sign, until I can prove otherwise. After 20 years in this field, I mean that literally. Sleep apnea, where the airway partially or fully collapses during sleep, is one of the most underdiagnosed conditions I see in patients over 60. More than 30% of older adults have some form of it, and the vast majority have never been diagnosed. They have no idea what it is doing to their heart while they sleep. Let me show you exactly what happens. You stop breathing. 10 seconds, 30 seconds, sometimes longer. It might happen 40, 50, even 60 times in a single night. Each time, oxygen in your blood drops sharply. Your brain registers a crisis. It fires off a stress response. Adrenaline, cortisol, a sudden spike in heart rate and blood pressure. Your heart jolts, hard, while the rest of you is still asleep. Now imagine that happening 50 times a night, every night, for years. What that does to the cardiovascular system over time is not subtle. Sleep apnea is directly associated with a 3 times higher risk of heart attack. I want you to sit with that number for a moment. 3 times. It is strongly linked to atrial fibrillation, an irregular heart rhythm that dramatically raises stroke risk. It accelerates the hardening and thickening of arterial walls. And because the person is asleep through all of it, they often have no idea anything is wrong until something serious happens. Now, the warning signs are not always loud snoring. There are quieter ones. Waking up with a headache most mornings, feeling exhausted even after a full 8 hours, waking up with a dry mouth or a feeling of gasping, needing to urinate 2 or 3 times every night, your partner telling you that you stop breathing, even briefly, during sleep. If any of those sound familiar, I want you to talk to your doctor about a sleep study. This week, not eventually. This week. Because here's what I tell my patients directly. If you snore heavily, if you're over 60, and if you have any history of heart disease or blood pressure issues, getting evaluated for sleep apnea is not optional. It is part of taking your heart seriously. The treatment, most commonly a CPAP device, is not the most glamorous thing in the world. I know that. But the data on what it does for heart health is remarkable. Patients who use it consistently show measurable drops in blood pressure, lower rates of irregular heart rhythm, and significantly reduced cardiac risk overall. One device, one habit, enormous protection. Does anyone in your household snore? Have you ever been told you stop breathing in your sleep? Don't scroll past this one. Now, this next habit, I want you to think about whether you do this, because the reasoning behind it is completely logical, and that's exactly what makes it so easy to miss. Many people over 60 deliberately cut back on fluids in the evening. The reason makes perfect sense. They don't want to wake up twice a night to use the bathroom. They don't want the disrupted sleep. They don't want the fall risk in a dark hallway at 2 a.m., so they stop drinking after dinner, sometimes after 4 in the afternoon. I understand that completely. But here's what most people don't realize. Going to bed even mildly dehydrated is a meaningful cardiovascular risk, and almost nobody connects these two things. Here's what happens inside your body. When you're dehydrated, your blood becomes thicker, more viscous. It doesn't flow as freely. For a young cardiovascular system, that's manageable. For a person over 60 with arterial stiffness, in blood vessels that may already be narrowed, it's a very different situation. Thick blood moves slowly through tight spaces. It's more prone to forming clots. And here's the timing problem most people never consider. During sleep, your heart rate naturally slows. Blood moves through your system more slowly anyway. You've been lying still for 7 or 8 hours. Now combine all of that. Thick blood, slow circulation, a body that hasn't moved, in arteries that already have some narrowing. That combination is one of the reasons heart attacks and strokes cluster in those early morning hours. The fix is genuinely simple. Drink a full glass of water before bed. Just 8 ounces, that's all. Enough to prevent your blood from unnecessarily thickening while you sleep. And keep a glass on your nightstand. When you wake up at 2 a.m. with that dry feeling in your mouth, that's your body asking for something your heart also needs. You don't have to choose between sleep and protection. You just have to drink a glass of water. And now the last one. This one surprises almost every patient I mention it to, because it sounds almost too simple to matter. What temperature is your bedroom at night? Most people have never once thought about that in terms of heart health. But there is a specific range your cardiovascular system prefers. And outside of that range, your heart is working harder than it should be every single night. Let's start with too warm. When your bedroom is above about 72 degrees Fahrenheit, your body spends the night trying to release heat. Blood vessels near the skin dilate. Your heart rate stays elevated. You sweat, which accelerates fluid loss, which brings us right back to the dehydration problem. And critically, your sleep quality drops. You spend less time in the deep restorative stages where your heart gets its best overnight recovery. Now the other extreme, a bedroom that's genuinely cold, below about 62 or 63 degrees, creates a different kind of stress. Cold causes your blood vessels to tighten to preserve core body heat. Blood pressure rises. The heart has to push against more resistance. For someone with existing blood pressure issues or arterial disease, that nighttime pressure increase is not trivial. The ideal range is between 65 and 70 degrees Fahrenheit. That window keeps your body in neutral territory. Vessels relaxed, heart rate low and steady. Sleep stays deep. One thermostat setting. Real protection. Zero cost. Now I want to give you something concrete, not a long list of things to worry about. A simple evening routine that addresses every single one of these habits and fits into a completely normal life. Here's how it looks. Between 6 and 7 p.m., your main meal. Lean protein, vegetables, a moderate amount of carbohydrates, A real dinner at a reasonable hour. Not a feast, not skipped. Just dinner, early enough to give your heart 3 to 4 hours to settle before sleep. At 7 p.m., water and medications. If your doctor hasn't specifically discussed the timing of your blood pressure medication, this is your reminder to have that conversation. Evening dosing may offer you significantly more protection. Take that question seriously. Between 8 and 9 p.m., your wind-down window, a gentle walk, some reading, step away from bright screens, your phone, your tablet. The blue light keeps your nervous system alert far longer than it should be before sleep. By 9 p.m., check your bedroom. Adjust the thermostat. Set it between 65 and 70 degrees. Put a glass of water on the nightstand. This takes 90 seconds. By 10 p.m., in bed, on your side. If you snore, if anyone has ever told you that you stop breathing, sleeping on your side instead of your back can significantly reduce airway collapse while you work toward a formal evaluation. A positional change. No equipment, no cost. Real effect. Dinner by 7. Water and medication at 7. Screens off by 8. Room prepared by 9. Bed by 10. On your side. The data behind this routine is clear. The only question is whether you'll actually do it. I want to be honest with you for a moment. Not as someone making a video. As a doctor who has been in this field for over 2 decades, I have sat with families in the early morning hours after someone they loved didn't make it through the night. And in case after case, when we looked at what happened, it wasn't a mystery. It was a late dinner, a forgotten pill, a bedroom that was too warm, a body that slowly ran dry of water through the night. None of those are exotic. None of those are rare. They happen in millions of homes tonight. And the reason they keep happening is not because people don't care about their health. It's because nobody told them. Nobody connected these ordinary evening habits to what happens inside a heart at 3 in the morning. You now have that connection. What you do with it tonight is up to you. Let me bring it all together. 5 habits that put your heart at risk while you sleep, and 5 fixes you can start tonight. 1. Finish your main meal by 6 or 7 in the evening. Give your heart time to settle before sleep. 2. Talk to your doctor about the timing of your blood pressure medication. Ask specifically about evening dosing. That one conversation could be the most important one you have this year. 3. If you snore, if you wake up exhausted after a full night, if anyone has ever told you that you stop breathing, get evaluated for sleep apnea. This is not optional after 60. It is part of caring for your heart. 4. Drink a glass of water before bed. Keep one on the nightstand. Do not let your blood thicken overnight to avoid a bathroom trip. 5. Set your bedroom between 65 and 70 degrees. That one number protects your blood vessels every single night. I want to ask you something directly before you close this video. Which of these 5 habits do you recognize in yourself? Be honest. Leave a comment below, even just a number. Which one hit closest to home? Because here's what I know after 20 years in this work. Most people recognize at least 2 or 3. And recognizing it is where change begins. If this video gave you something useful, share it with someone you care about. There is someone in your life, a spouse, a sibling, a friend, who has never once connected their evening routine to their heart health. One share tonight could be the most important thing you do for someone you love this week. And if you haven't subscribed yet, do it now. Because what I share here are the conversations that should happen in every doctor's office. They just usually don't. Take care of that heart. It has been working for you every single minute of every single night for your entire life. Give it what it needs to keep going. Everything in this video is general medical information based on current cardiovascular research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medication schedule, especially timing, please speak with your own physician. That's not a disclaimer. That's genuine advice from someone who wants you watching this channel for many years to come.